Om khol bangina tunita kina program hizang thedin neoma panel discussion hizang thedin neoma chibang honoin musaki biak pathian tunga masa penin ki pa thui ge nahi topic di ngai te le ki le thupi di ngai te le COVID-19 unlock and the threat of here yang ngai to na tuam ekile idea tuam ti hon share digina ya panelist member digina mi HLT Dr. HLT leng avekina ong tel thi ki ma le atam song tel thiwa ki pa hoi sa pen ma mauti Evangelical Baptist Convention Healthcare Board te sig data gina kon na vai do nahi e panelist introduction ni kon nei dinga Here kasika tu kavela matu he Dr. Seilaja here chest physician district hospital Churachandpur tulelina isolation ward in charge hi abana Dr. Lalbiakdiki here physician here district hospital Churachandpur dinga COVID related in charge hi Lamka ading ina COVID response to kesaya amo pupipin chinagien lengi hial keding abana Dr. Pricilla Chingbiakhoih ya medical officer district hospital Churachandpur ya wai bana Dr. Thanglalmuang medical officer district hospital Churachandpur ma ya Mahi tulil na team leader rapid response team ahi aho sahan panpoitu ding ina Dr. Thangginmang ahia maleng medical officer district hospital apatahi I thi sa chat bangina banga COVID-19 hi evangai to le boy huai pi athi siam huai lo wahia banga alaw le law lo ka hi ki gamla ngai dan tuam hi atuam to ma zuin thata hi chi bang uchi ke le hi tang mai hi chi bang eke le law lo chi hi to mai chi khong bang hi wa jo cha ki test lo di hi mai chi khong wa jo na government sumo na hi chi khong kha atang pi a kholaka tu thang eke le mi ti gen tang pian na hi mok da na hi mo chu chi hi lai la na mi tam pi na si lo tawa wai zo chen na mi tam pi na banga hi naw na tan ke hi loina banga kingai siat na uchi kile mani ki tha un na eke mani hin na la ku na tan phalenga na tun ta hi chen hoi je kina holim ta ka eke le gen tang ma hi china I panelist HL by nong telwa ki pa wai isa tak takin ki pa sai na che laudi le bangja ka laudi lao lâu đi là bằng giá cả lao lâu dịch đi à ít chỉ vel không ạ pan đi na kisah himem le mo quan non dok masa dewo
kan pau tu dingai
doctor rena
I ka host pau hi le upa Langsanglian hi coordinator hi ka letam pian hi yalam kun nga phot dinga den che helam hon nga non ni ka hi mi pite thei dia dei le mi pite thuma pi kon chi dinga thuma pi gen je kauta hei EBC sabtuamin kha health board kineya waitin kha hei COVID unlock to kisai ingai to chianga again home chianga kha I mi pi laka on unlock ya ei lama kilok leng chi hi ngai na lian piong ma government in on unlock nge ngeule ei lama na kilok le chi hi thu pi tun ta ka kon kwan sanu hiya wai chile mi pi ten bang chi pan khoma sabtuam te na sepna hiam ei kele sarkar te na sepna doctor te na sepna pan khom pi theding hi chi hi tun ta ka genu tang pe hiya wadina question tam pi ba le anaki kai khoma kon chi dinga den cha kalu tak mauna I mi pi te akwa te nek dak jong tom te kele bazara tu te hina akwa hitale na ki jong khom zeka wai te tung to na ka holim na hon nei ding ka hiwa I thei dia hei COVID-19 hongom zo apanina sapa bang le tampi ni pun bewa I quarantine chi khong ei kele social distancing chi khong ตัวมาเลยไม่ได้เป้ามาเลยที่เบว่าไว้บางวิมีจีของกิที่เบะฮีจีนคนเกียนจวลีอ่ะกลมเตฮี subject expert กันฮีวะก็แกตุป้าฮีเลยฮิวตุดร.ม่วงค่ะตุไลตะกะอามุขังเอโลบังเลยฟังมาดินกับกิงตามีอินเต็งมุนเต็งพา he's been around he's been like the living corona people call him the living corona and whatever it is and luckily so far he has been tested negative I think 5-6 times maybe yeah something around like that so he have lots of experience he have lots of things to share genule nei de hi tampi mo abana Dr. Pricilla kun le gen thak non mai dinga Dr. Pricilla hi le ana teng-tenga paina mun hi a phone call hi na ai kele a thelo le om ke dinga a mail ba le hoya a thelo le om ke dinga hoi bana a mail hoi zo sem madam diki agunda nu ka chiwa corona le lau rani ka chimai wa ko Dr. Lamtian rani hi jang ma kha corona le lau giat ve ma khong ki test ta negative lai hi patient tampi ama mai le positive tampi detect kha ko ma tu ni ma ba le ama sample lak te bang positive in ko na positive chi bang le ma hi hoi bana Dr. Seilaja hi le eilam mi hilo hi eilam mi bang sim le talpak te hi a me te hi a hi cha kha amale subject alung lu lo ja ka ei pau thei ki le hong tu hi amale idea seru tampi ne hi a I phatom piu le lamen ka hi mo ama kha isolation in charge hi a then cha technical term khong gen cha kha aman hon gen de hi she is in charge right now in isolation ward and she have lots of technical terms and technical numberings and everything she knows so she will be sharing but she will get her chance not now okay I'll go with Muang regarding Muang kha ei pan kun dong mai ding mo Dr. Pan khaun gen di kha I gen pa phu phu le sab tuamin kha unlock government kha unlock on nei un chen hile sab tuamin kha unlock zui di hiu hia ai ke le en anakilok son di hiu hia chi hin en khachi experience apan hon gen zole ma ngai dan kon dong di
unlock to lockdown chung chang chu lockdown continue di hile hinle I lockdown na le sotan ko man le ki zui zo talo ngo lockdown ti le hinle mi pi pot tho tho hi phat le lockdown jai ki ko pen le a hi lo di pi khat mo zui lo di pi again ma ki bangin a lockdown na lai na ngona le ki zui zo lo hi phat le unlock hung ki bol pen hi mi pi ten opportunity chance enjoy na ding ala lawin mani responsibility pen ha ki hetin SOP in ite hand washing wearing mask and keeping distance iti tevel hi izu den hoi kasa also le tu condition yel le chu Churachandpur contact tracing in charge in zalin mi tampi positive te la kahin unlock ahung ke pata ko chum pastor te bang abikin ki gen la ai khosung la kale pastor tampi positive ahungum panta isa kho lamzui dan pen kha bang ti dana kimanga him ti bikin sunga le kiet poimo ma sa khu ingai poimo jinglaya isa kho in pen kha spread na bupi na hi khak din je kha ai mi pi te kiven na ding mi pi te mo pok na alat saka neu khat vak gen beleng to sa kholam gen phal le tu na in mun choma contact tracing ki zikin tuibong lama panlen mo new lam kachana pastor bangza thiam hung positive ta pastor cho hilawin aji teo bang hung positive ki to yel chu pastor hila ko chumu pa hilele damlo pau chap pi ngai te wa pau chap pi hiam hilo le ku te ina wa chi hiam wa kholai le nga hiam ana sep didik taksem jinga hi laya amau mi to ki connect jinga hi phathule amau la kahin SOP wazui khalawai dim ti hole ngai dana kinaya sa kholam izak da thuna na hilawin mo jele responsibility pen kha ana zui khalo him te banga elaka thim puwa ine te pen virus hong iti phat la ifekwa pau chap na nei puitinu pastor te ngai khok puitiu iti na hilawin ingai khok dan teo a hilawle mi pi ten pastor ten pau chap na nei sak phathu la ana kichi bai se him pastorin hungchi bai ulo dele en ana kipete te him banga him tivel ikia thakdingin to yum kasa geleng ze topic khato sa pi hungchi di hintilat takchan khan chol photitino
to topic to kisai hi sa kho heutu te on gen khahia สาเขาเหวตุเตเลยพิลวันนะดิวตั้มมาด็อกเตอร์เตบานะคะ medical ด็อกเตอร์คนจิเกดิงะ medical คนจิดิงะ medical เซมเตบานะคะสาเขาเหวตุเตhi irresponsibility เลียนมาhiจีฮอนเกียนค่ะยาhiกันเลยก็ accept มาค่ะแต่มาhiค่ะมีปีตกิดีเลยมีปีละกาโปรแกรมมันติงะสาเขาเหวตุเตหินะสาเขามาใครเตกิจังตังปีกิจังเปลี่ยนเลยhi บ้านว่าคริสเตียนก็มาhi นะมั้งตุกิใส่ค่ะด็อกเตอร์เบียร์คอยน์ค่ะบางอาเกนุดคุมนบอันนี้เรื่องเกณฑ์เบลเลยหอยดีสาขวาโตโควิดกิใส่มั้ง
ตัววามินเล่บางตะกี้ปากาก็เห็นเดี๋ยวมวงินเล่บางใจมันที่ปากเกลเล่ก็ไงด้านบางใจมันก็เลี้ยงกูตาด็อกเตอร์มวงินเล่มันเย็นบางทีนะเนาะเอาค่ะ contact tracing ของไอ้ที่จะว่าคืออาทิตย์จะนี่ไว้ด้านนั้นเย็นไอ้ยาวจุมาบางทีนะ
คนขอสักส่วนอังไงโจกี้ด้วยให้เกี่ยจังเลยจะนั่งไงดีตัวพิกค่ะป่วยมวยจังมั้ง
สักวันน่ะ Christianity Christian เงินหิตังปีนะไงป่วยมวยไว้มาจู่เฮียหิมาเลอีกินดานาเลค่ะคริสเตียนเตะที่จะเบียกคมน้าว่าไปเสียกี่เลหังเลมั้งเบียกน่ะค่ะมาเลมาตัวปฏิญาณกิกาลเลหิน่ะตั้มเปียวมาตัวมวงินด็อกเตอร์มวงินนั่นแชร์มาบางยินนะมีตั้มปีโปรแกรมตัวอันล็อกของหิเลของกี่หงกิเตียนนาฮิตาเลกิเลเบียกินกิขบนาบังอันนี้ของกิออกมาไว้ที่ฟีดแบ็กที่ไม่นี่กันนะจักฮักดานินะตัวจุยเดียกิบอล government นี่นะบอลไม่ตัวนั้นมาจัดดีจีบังกิเลขุดซิลมุนดีขุดซิลเสียงดี sanitizer เฮียมจัดกิเล social distance ค่ะเก็บบิดดีจีเตะค่ะกิจุยโลกเราอบังฟีดแบ็กตัวให้เบียกนาอันกิปัดนามุนเตียกิจดานีนะมั่วเบียกนามุนแก่ฮิโลวินะมีปีอมคมนาจิไม่นี่สิกาลนาเฮียมลบนาฮิตาเลอันล็อกของฮิตกิตัวนี้นะไว้มุนเตียค่ะกิจุยกิมเฮ็ดเราจิไม่นี่อาจุยเลอะตอมจะทำให้ดินกระยิงตาไว้จะกินะนิดติงนะเคสบางปุงหุลนะบางจีเดีย alarming มั่วปัตตาไว้เลกิสาเฮียไว้จะกะเฮวตุเตียนเลให้ด้านโปรแกรมฮอนโซมุเลหิมันนี่นะหุ่นบางเบียกนาเตะของฮิเกนี่วัชิเวกเทเราหิมันนี่นะมีมัลขัดจ้าตินะสับตัวเฮวตุหินะมีปีเตหิเลงะอีหมอบวกนา irresponsibility ขัดเฮียจ้าตินะกี่จู่บางบักก็จะกี่จีหิมอกเราวินะมีก็โลส่วนคดีกี่ดำเล็งเละอันนั้นนับประตูอภิส่วนตัวก็หิคดีจีไงตัวนาเนี่ยมามุกตัวน่ะมาสวยตะกาจัดดีหิกิเลขุดซิลมุนหิกิเล sanitizer บางจัดหิกิเลมีโตอีอมโฮมอีดินโฮมจังอะไร distance maintain ค่ะหิเทเลจู่ป่วยโมมาเลพิลวันหัวหิดินก็ยิงตา
กี่ก็เป่าตัวไหลดิงกี่เป่าไว้ดอกเตอร์เบียร์คอยสับตัวมันเตะใส่อีจาการสับตัวมันตีอีหาเกนเดียวบ้างอีเทียเดียวจุป่วยโมค่ะเบียร์น่ะเขาขามเราฮีก็มันเบียร์นั้นขามเราฮีเลยฮีเลยเบียร์โคมน่ะเปลี่ยนค่ะบางจิเลงอีเบียร์โคมจังวันนั้นอีกิเวงเทียเดียวจีฮีกี่หาเกนอุจจาฮีมีปีเตะเทียดินมั้งเฮ้ยเบียร์โคมน่ะเปลี่ยนอีกิเลสับตัวมันตุกิใส่ฮีจิลำปังอินเดนเจอีเกนทั้งนนเดียลุงสิมอมดานินมั้งเมดัมดิกีดรดิกีนค่ะฮอนเกนดิฮีCOVID ward isolation เลยคนจะเกี่ยงCOVID ward คนจะเกี่ยงCOVID ward ตัวกิจใส่ค่ะเทหินะ patient ขัดอง positive ตาดำโดยนะเขียนสักเดียวไปไว้เป็นค่ะบางจีปันลักเดียก็อยากก็ดีไอ้เกลบางsymptoms สิจีบางสวะเขียนเทนะบาง mild moderate severe จีอมเฮียไอ้เกลหอยเตะก็อยากก็อยากอะไรหอยด้านหนึ่งค่ะจิฮอนเกียนเลยหนึ่งข้าศึกเฮียมีพิธีเทียดินมั้งดำโดยนักเรียนสักของไปเตะ positive เงี้ยอินกิกนอนเราดิก็ลำตุงดีว่าอะไรเอาไว้ตะกินเงี้ยเลยอินลำตุงนอนเราก็ลำตุงดีว่า serious ตะกุเลจูอลวงบังอุเลว่ากี่ข้าที่นอนเราดิตุกข้าเราหอยค่ะไม่ดำดิกินข้าวเงี้ยเจ็กเลยหอยดี
COVID ward isolation ward kan soi pol vek to tu na chuan ain ang vek to Dr. Biakhoih na soi ang deuh khan COVID case hi asurin asura apatau huai ponilo kan patau takzet kan lau thong takzet to kan kan ngai to achan chuan kan mu theilo kan tho acham March April la tang khan kan mang an na kan thena ko shana kan thena mi puya kan thena kan awa khata kan aw la ai khan tu na chuan atak tak athenga kan manga ang takzet to ani tu na chuan ti ngai na kan she to lo kan voina ringo thian pathum pali panga pasari vel dam do ina kan muchwa ka an kal na tur om lo engma na nei shan lem lo om te chu ina lo wo ho phot ula thadewin lo wa in khung ula symptoms engemo in nei chuan anat na lan chuan ati om chuan in ron in report watanga chu tiang om lo chuan ina thadewin lo wa in khung ula midang kai thong lo turin I film khur ula ti kan cha kan kha top to nimin vela tang khan anom na tur om to lo kan tha chwa te kha ina anwa honga nga thu oi dewin anwa omange kan in kan khosak danen ang lowa then khachu ina room sang nein om sang theinan omanga a then chu alo theilovin chung tinen an ve in mix le don chuan kan society dana kan soisa tho chu ni ma se kan in tlo po liai ya engi an kan wadak sham ti ang te khane engangin nge an kai chon don kan she phato lo kan ve seng lo chuan natna an nei deu chuan natna enge mon ne ye mo hlo thon om dewan omero chuan ina kan ho tir lova COVID care centers kan nei tia hian mild symptom tlema khosik deute thoha nei lem lo luna taksana ti ang te kha kan da chuan an serious tak huna chuan dam do ina admit an ngaya kan soi to china kan tlang aw hla ber chu kan hospital district hospital kan nei ve Churachandpur ina district hospital kan nei chun hi COVID kan ramaron thlen tir atang khan ipu ang u covid case kan nei huna seriously an enkol then turin ipu ang u manra kan mammo watchan kan mammo kan tia kan awa kan thei ang tok chuan kan lo buat sai vi ama se tuna chuan kanin buat sai na ti atlin zo lo zia alang chiang ta tula tuna tak khian damdo ina son kan wat kan isolation wat ta son serious pathum kan neya tuna pro ka chanu pun phone khoi mol mal kha tholei thei lawania pakhat chu apum apwara e thei lawin oma chuanin pakhat chu ni jana ta to bp sang nen tho ha nen ni ko shemang lawin kan boy puya hemi te pathum hi rimsa emo jenimsa emo son kan du'a I achan chu heta an om hian antigen test angaya an hemoglobin an kidney function an liver function acha zelem ti te sangaya tuna kandam local te so antigen test nan kan laboratory kan mangani chuan covid ni velo ho tan amix theidon silova covid serious AMT hlo om pathum kan nei mek lai hian ward danga covid ni lo thi hlo om som tam tak kan neya covid na te kan ngai poimo don khan COVID lo hoinan tuar don si chuwang chuanin higher center Imphala Janimsa Rimsa thon kan du'a tuna yan khulama mun ong om lo wangin an nga ka kan thiang angin an blood parameters kan test theilawa kan rin thu devin tibela an symptoms atanga ani om anga tangin ti hian dam doi kan pe achon kan ti chho chu ania mishing kanin chanzo ange chanzo lowang chu ka shelawa chuwangin a seriously asymptomatically a serious ber inkar hian chi sang ombe ni chon annat na covid kan mu chwana chan hi thoha awang le khosika wangin ani vek lawa a then chu chemotherapy cancer awanga chemotherapy la mek te chemotherapy an lak le don awanga kan test te chon nimina khan dialysis kidney failure dialysis ti ngai test lovin pong pati mia donila khami dialysis low positive ti na huna han positive ni lo khati ila kha khan akai chong thei don sia test lo the ni si lava chu kidney failure ni to sa kan tesa alo positive chuan chen khachu in zai ngai natna dang de wang operation ngai an operation don wanga kan test te นัดจีช่างค่ะอันนี้วิอาโควิดอันโพซิทีฟบางเฮียนอันนัดส่งเขาข้อสิกเลียโทหะอันนี้เวกจวงเลยวะกันหูชวนนัดชนะจีร์คันข้ากันหันหูชวนตัวอันโพซิทีฟตัวจวนมีดังซิงอ่ะกิดนีเฟลเลียข้ากิดนีเฟลเลียทรีทเมนต์ปังไงกันชุนจมเทตเลยวะเคโมละเมฆข้าเคโมกันชุนจมเทตเลยวะคันนัดดังส่งให้อันนี้เวกทว่าโควิดโพซิทีฟยันข้าทรีทเมนต์ดังหาฉันปังอ่ะแต่ทรีทเมนต์เซ็นเตอร์อ่ะโฮสพิทอลฉันทบสเปเชียลตี้จะช่างกับเฮียวเอ็นโคลนักกันนี่เที่ยสีเหล่าจวนอันเอ็นโคลนักเมฆขันอัตวาระเอ็นโคลชุนจมเที่ยเราวินอันกิดนี้เอ็นโคลชุนจมเที่ยเราโมการเซอร์ชุนจมเที่ยเราโมข้าอันเชียดปุยตูร์จอันนี้โดนนะตรงทุกเชลว่าโควิดข้าที่ปุยแค่เรามาสิละโควิดนี่เราวันนั้นปุยข้าอันที่ปุยโดนตีนะอันเนี้ยจุมังจานินโควิดที่เราตักเรานัดดังในเราที่อันที่เรากันตีเมฆลายินนัดดังในที่อันเราไก่ชนเจ้าคันข้ามีอันนัดดังข้าโควิดแต่วางเงินอันที่ปุยโดนถูป่วยก็กลับสันได้ยินก็เชีย
พอยลูอีลุงลุ่นนะอี subject มาเฮียไม่ใช่ก็ให้มาเกียนเหียงมั้ง question เสียดงเขาเกลี่ยเลยไม่บินอันนั้นมันลงมาเดียวฮี thank you คนจะพอดีงาเดินจะเลยrelated topic again ขากลมเลยโน่เลยนนเกียนทดูมั้งอีเลยไม่ปีเตะที่วุฒิโควิดให้ต่างเปล่ามาอีโควิดเฮียก็ให้ต่างเนาะโควิดก็ว่ากิเตสกี่ดีวัดเตะว่าโหเลงว่านะ positive สักเดียวจีบัง again ต่างเปล่าเฮียเป็นฮีmedical term ละมาปัญจุเลยโอเคให้ต่างเลยไวรัสก็แต่เฮียอีกคนคนดงมองดิ่งอ่ะกี่ที่นั่นนี่นะฮิตังเลย positive ฮิตังเลยไวรัสก็แต่เฮียพอฮิตังเต็งว่ากิเทสเลยเทสบังจะออกมาไอ้กี่เลยบังเป็นอ่ะเทสเอาคุยเป็นหอยเป็นอ่ะจีนั่นดงไงเดียมไม่ดำดิกีนะtest different type of test I mean the sample and if they are having flu like symptoms RT test le positive demo RT-PCR mo or whatever it is on gen zeg le chen hoi dia le
just a minute to a question ka kon bi lam dia mo banga false positive false negative rectia the two minor NDTV news mo false positive khatamahi ichi honge kile false negative Manipur hoi la na false negative tamahi chidana na kithia himale banga false positive he tamahi ichi dan khonga na oma uchi le bang ka false positive he ke false negative om thia hi dia mo vai bana test ya more reliable ke legin ta khwai zo recti sai na PCR test hi ichi achi le PCR test hi kwati a dia poimo mi mau na zila uchi poimo dia komhia e ke le meeting tinga dia hi thi ya chi bang mo to question na kon belab de question na tranghan test ji sang kan nei chu kan sheta RT-PCR kan nei ya chuan thuna kan nei ya chuan RAT tunlaya kan manlar deu local kan manlar RAT rapid antigen test kan nei ya antibody test kan nei boka kan sha thiam theu angin shik virus kha kan taksa alo luta any other virus corona ni kherlo poni se typhoid malaria engshik poni se kan taksa alu khan khamik ashik lut khan antigen kanti nat hen tu atur kha siam chhuak don ta ni ashika omanga shikin tur siam chhuak anga chuti mek lain ashik alu khan kan taksa hian shik dona siam chhuak ve don buka antibody kanti kha chu infection kan neya aman chwa dan chu ashik kan mu fu in infection ani lo chuan ashikina asiam chwa antigen kha kan mu chwa in infection ani lo chuan kan taksa ashik alu kan taksa alo siam chin antibody kha kan mu in o shikalo lu to chin ani hi kami man chwa theina kha chi thum ta ni chuan achang ber chu a virus kha kan mu ngei chuan achiang ta Indian corona chu ala thar dewa kan chia thia mahar sanga TB nen lo te khinta ila TB chu kan zinga omna rei to TB nat na kan ring hlel chuan an kha kan te sa kha ka khan TB shik kan hu chuan achiang TB a aron chuak ti na ni ta chuan test dang le a chuanin
ที่เซนเตสตรงอิน TB antibody ไตฟอยด์ตานักันมันชินตักษาอาชิกอลูอาขมิชิกดูตูตักษาอินอารมณ์เสียมชัวค่ะ antibody ค่ะที่เซนานิตาอามาเอโรจู antibody เอโรฮิจูนัดนาเวกเฮโลปนอามุอันนัดนาอดัมโตหัวโปกันตักษาอินอดูนาตูร์เสียมค่ะเองหมดเจนะอมาวางินอาชิคิตูนะอมโตโลมาเซชิคกะเลาไกฟูจวนแอนติบอดีค่ะเองหมดเจนะอมโดนะจูวางินa specific วักละวะแอนติเจนเทสกันตีเลจูชิกอาชิกนุงตักกันหูโลปอินอาชิกินะอาเซียมชัวอีนัดเห็นเทยแอนติเจนค่ะกันหูจวนโอชิกอลาวลุดเงียนี่ฮีตีค่ะไอเอ็นตีร์บอกตาอาจางเบอร์จูอาชิกเงียกันหูอินจู่ๆ RT-PCR จังอินอาชิกันมุอินอาจยังตามาเสีย RT-PCR โคลฮิโคลเลียนทำมันยามันรัวเนียนโคลเนียนอาเซียนโซซงเนียนจวนหน่วยสมงานหน่วยสมรุกเสียนไงตัวเรนเฮตากันติเทลวะแอนติเจนเทสฮีอุลสมามุนตินะเองมาเซตอัพไงแล้วว่าติเทียนยากันมันลาร์เบอร์จูอันยา false positive false negative อมเทนะชันจูอาชิกะฮิที่เซนะจังเตสนี่เสียงจวนกันที่เซนะอมค่ะกันหูจวนเองติกไลปุ่นที่เซนะขันอมไม่โดนะโคโรนาเตสนานักันมันฮีเฮตะกันช็อกเวลจังsecretionsเฮมิตุยนางรอนชัวกจังเฮียนอานิตานีเวลาไงปะsample ละตูอินalak fu lo mo alak dan adik lo devina mo ani lo point entinan RT-PCR kan thon don chuan sample kan laka infala kan thon thaka kalkonga a cold chain kan maintain lo chuan virus nung kha kalkonga achidona sample kan lak chu akhan thadewa a virus thilo tura temperature nyama kan da chatanga ya chuan ates na tur mun him taka athlenanga ya chu tunlaya an soilar chumi huna chuan an test a positive an ring hlela atu kan test le a negative RT-PCR an test a voi khat a positive ati chuan keni chuan positive a kan nga ya achan chu RT-PCR chuan a virus kha khami a DNA kha alo amplify anga a amplify no COVID-19 virus DNA nge ani e ti hnuwa khan positive ta ani khami thau kha unlock non le khan entirnan nimina sample le vo ina sample shitang ang deu ani kan ti to kha ni kha thil thuwa kan enge kan khak chhuak te mo kan secretions kha ahul hukin atam theya voina la non le ta ila amun ngai la punila a secretions alo omwak lo mai thei chuan a virus kha ka taksana na do theina khan alo do na wangin a virus kha alo clear ve duak thei boka kha kan la non le ta a khami sample kan virus kan hu to lawa amai ro chu nimina ka sample an la ka a virus nge an hu ani chuan an hu kha kan poma voi khat RT-PCR in a hu to chuan a hu kan ti amai ro chu antigen le antibody hi chu a virus nung kha ani to lawa chuan COVID chuan kan soi chiang theilawa anat na hi athara kan she chiang lawa nat na danga chuan intinan typhoid ti ten nat na sang chuan cross reaction kan tia scrub typhus veite scrub typhus dona antibody hi typhoid nat na veite dona antibody ne ain ang tho chuwang chanin nat na pa ngai do tu antibody a detect theina reaction in an theya wangin false positive chu om theya ama ero chu covid chu soyang khan atharania eng ne nge cross reaction nan ne yang chu kan shelo ma se possibility is there antibody antigen a chuan ama ero chu RT-PCR ero chuan a DNA nge andron amplifier mu ania wangin RT-PCR undetect to hi chu antes le a mutolo poni se a virus kha taksana lo clear ani thei an sample la ka khan a to lo a an la fu lo poni thei emo sample an la ka tanga a test na tur huna thlen chung khan a temperature te lo fu lo a virus lo thi to ani thei amai ro chu nimina an hu chuan khami kha chuan virus chu akai ngei ti na antigen le antibody ero chu 100% in asoi thei lo na shik dang reaction poni thei
achile chu to nagin da na pata tunia PCR test PCR khab muan hoizo ekile ginta hoizo ekile dikzo mo achile PCR atu ni test pin kha jing chang he ekile jing halina test non le banga negative atunia positive kha jing lam ekile banga aninol lama kha negative chom the hi awai negative yakha awai sample collection na chike sample handling awai zon lakti adik khag lo je ka hi ma
or ani ana clear hi
pai khag lo je khi thi hi
a virus kha a body immune system in ana clear le hi thei
uchi lekha chu body system in ana clear lekha chu ama kha covid free ong hita di chi na hi mai ma okay
technique sensitive mama khat hi bana kha technically faulty le chu negative banga fall negative result pothe hi chiang mama here we have been I'll go to Madam Seilaja. She is the in charge of this one COVID ward / isolation ward. Okay, she is a specialist as well as TB specialist. She is the subject expert right now. We have been preparing since the last 7 or 8 months. Now we've been very tired. I think when the real war comes, now we are tired and we want to give it up. So far, how many in Churachandpur? I'm speaking in Churachandpur. How many patients have been positive in Churachandpur, and how many patients died, and how many have been contact tracing? Can you highlight a little bit? And the second question will be, in COVID ward, isolation ward, what are the basic requirements, like the instrument, the infrastructure? What do we need for a COVID ward? Can you tell a little bit about that?
The COVID started like from March. So in isolation ward, we have admitted, including today, we admitted 5 patients today. 3 of them are very sick. 1 or 2 of them are very, very sick. So like including them, it will be 69 in total in isolation ward. And the problem is we don't have much beds. We are occupying all the beds in whichever is available in district hospital. Like the casualty has been moved and then we are occupying our isolation ward. And previously we had used the medicine ward, but medicine ward as such, there are so many patients from the general population. So we had to keep patients in general medicine ward also. So we are actually very short of isolation ward beds. So if there is community transmission like what is going on right now, in Manipur today itself, around 230 or 240 were positive, only today. Yesterday also it was like that, 240 around. So if it continues to be like this for another 1 or 2 months, then it will be overwhelmed. There won't be any beds all over the Manipur, not only in Churachandpur. Right now there are no beds in RIMS and JNIMS. So we started keeping patients which we are not ready for, the sick, very, very sick patients and dear ones. So we need to think over it very carefully, and we need to follow the protocols like wearing mask, hand washing, social distancing, and moreover, do not go outside your home without proper reason. Don't gather in a large community and all.
Let me interrupt, madam. Those advice, all the public have known. Everyone, all the smallest to the youngest, oldest, everyone have known mask, social distancing. So
no, the real reason has started just now.
Yes, I want to
the reason before it was only the returnees from outside, and out of 100, only 10 or 20 people were positive. But right now, out of 100, around 70 or 80% will be positive.
In Churachandpur district, how many person died so far?
7 people have died so far.
And how many cases have been detected?
Huh?
How many cases have been detected in Churachandpur district so far? Positive patient, how many positive
around
patients?
11,000, I think. 800.
800?
Yeah, something like that.
Around 800
yeah.
have been positive, and 7 people have died so far.
Yeah.
It's quite alarming and danger.
And most of the serious patients were referred to Imphal, like RIMS and JNIMS, and they were being treated there. So they have facilities, laboratory, like Dr. Diki has said, they have all the facilities, but in Churachandpur we don't have much facilities. So if we are to start treating patients, then the whole district hospital has to be converted to COVID hospital. Otherwise, we are not equipped to run a COVID ward, COVID hospital.
Madam Diki, you have to say something?
Just to supplement, usually, we cannot prevent death. Ours is a hospital and death always occurs. Usually, death rate in medicine ward is around 15, 16, 17 per month. Since May, June, July, our death rate is around 23, 24, 25. Obviously, the non-COVID ones are already suffering because of COVID. And now, we are starting to admit COVID patients. So, the COVID are slowly displacing the non-COVID, and the non-COVID terminally ill patients are not going to have any place. That's one. Another one is to supplement what Dr. Seilaja have said. Death, we cannot prevent death. We can never prevent death. It occurs all the time. And not that we challenge it, but when the time comes, when it is time to bid goodbye to your loved ones, it's horrible to see them die due to COVID. Out of the 8 people who have died from Churachandpur, 2 have died in our isolation ward in our hospital, and we have both witnessed them dying. It's horrible. The one death is Jawan. His near ones are not around, so maybe it's sad, but it might not have made much difference. The other one was a 70+ lady who would be normally dieable age. But she had to die there, even though her loved ones would want to surround her and when it's time for her to go. Then there's another one, the one father of our senior colleague, 90 years old, Putar. His family had taken very good care of him. At 90 years of age, they had even put a pacemaker on him, which is very rare in our community. In our community, if we detect someone having heart block in an 80-year-old, the family, we usually say, because of poverty and because of ignorance, we would usually say oh, he's old enough and his time has come, it's God's will. But old grandpa, the family had taken care of him all his days. But in his final time, when we found out that he was COVID positive, he had to be separated. And he had to just die alone like that. Just to share experience from my colleagues, everybody have known there are already 7 doctors who are positive in Churachandpur. Nimin piakan kan colleague pakat kaba visita an ina. Asoichu, he don't have any symptom. He is all fine and okay. Dong tu chelawa. Ti lau amo nat lau lamani lau. Astigma hi ashe omani. Window atangin. He had to watch his children playing from the window like this. Mishi Sel Chuan, not chat kan lau lo mai thei ma say you have to be away from your loved ones. Chuwang Chuanin a lau lo pol chu kan la thawa. Kan nat puyanga kan thi ang ti lau kher lo ma ila. A stigma can tell the social stigma and the
protocol.
The protocol, it's horrible. Nat ay na siya omzo. Ako heart thak bok.
Dilla manon gen khak mo. Churachandpur District Hospital at was serious deo. Ikile nak ta kadamlo. Mi thum khongom chi china to infala refer dia panlama. Chile อาตังปีอุจิกิเลหุนดังไงนาทีดานาขัดจูขุดจะดำโลเตภายของว่าไปอุ่นจินตุยลุมโดนอุ่นจินวิตามินซีแท็บเล็ตเนี่ยอุ่นจินหุจะดำเซลไม่ว่าดำโดยละอมต้นเลยเชียงตุยลุมโดนมั่วอุจิกิเทียนจินอาจิเลตัวที่บางเจ้าก็หุจะ serious แต่ก็ดำโลวิฮะบางกุมบางตัวลายมีวิฮะอุจิกิเลอุปลามาฮิวฮิฮะอาเจ้าก็เลยต่างปีขดต่างไงด้านอมขยายมินจินเกี่ยตัวอะไรงาเกี่ยหาอะไรงาหัวใจก็กินวิลิงเลยบางหุ่นจีเปียนักเปียถวกเราดีก็ฮีจีจะคงอัลลอฮ์นะครับเกี่ยมสักกี่จุดเบสักกี่จุดมั้งเลยหุ่นจีนจีน่าจีเลยตัวไอ้ดำโลไอ้เก็บเตมีถุมไอ้เก็บมีงาที่อากิมากิมเตบางจีบางมีหิวว่าไอ้ก็อินเฟคชั่นอมเสียกามเอาจะนักกิมเดียกุยาหมดตัวอะไรที่เดี๋ยวเล่าไว้ไอ้กิเลอุปติเดี๋ยวเล่าไว้หนาปังเดี๋ยวเล่าไว้มาเฮียไอ้กิเลเฮียอินขักกว่าที่อันหาลูซาตินักเพียลูจูเดียเฮียว่าส่วนละก็บางอย่างขัดมันกินที่อมเดียว
talking about this three people ปัจจุบันนี้จานักันดิเทกันยาคุมสมรุกเลตีอันยาอันนี้นัดตักินสอยลงโลกิละจูอินมีอันนี้อาทิตย์นัดจักวักเหล่าสาทิลดังอาจวนนัดน่าอันนี้ละวะมาเสียตูน่ะกันคุงช่างจูอินเทลเอาพอตาจวนอาทิตย์นัดน่ารอนหลังชัวกะจวนตูน่ะโทกรอนหาจันตาโควิดวางตัวนัดเบอร์อิน liver problem เราในสาอันนั้นนัดดูเทน่ะจักละวะจวนจูอินจาร์ชินอันอินตะเราบกะอบไว้ทักตานี่จวนปัจจุดำด้วยน่ะอมซาobstruction งอยบล็อกอมซาอันยาจวน TB suspect นี่เมกบอกอันยามาเสีย proof จ้าเราอันนี้ติกันมันนี่ลูกกันวัดซงกันเตสจุมีจวนอันละ negative เนี่ยจุมีนัวจวนเขาจะจังเงี้ยกันเชลว่าเกมันนี่ staff เนี่ยพวกกัน positive จวน visitors แต่ปนยังvisitorsที่เองติกไลพวกอินตั้มเราตูรินอินโตเราตูรินที่ไม่ละเองกันปัจจัยทู interpret ดานินดำเราวันอมิน hospital อันบุลาวกละจงใจโดนพวกอันรู้จงว่าจงใจที่อัดจูลัดชินวังเห็น visitor ที่กันอินดัลเสียงจวงเราวะตุนหัวพวกยันจูเขาจะจังเงี้ยกันเชลว่าดำด้วยนะลูโดนะ admission กันเทสา RT negative อันหัววัดจง RT-PCR กันเทสา negative วันนั้นขันเรา positive ตาจู่ส่วนขันlocal transmission นั่นตัวเขาจะจังเบรินยี่อารมณ์กันละสวยเทแล้วว่า everyone next to you is suspicious อันนี้ทบตัวจู่นั่นไอ้ซาจู่อันนี้เงี้ยจวนวันนั้นมีทะเลจู่คุมสมรุกเลติเท่าวันเนี้ยdiarrhea ก็ทะเลาะวางช็อกกับอมซาอันเนี้ยจู่COVID วางก็ทะเลาะขัดยาอมข้าอันนี้เทียอันนี้เราพูดอิน like co-infection co-incidence พูดอันนี้เทียเท่าว่าอันเจ้าโรคจู่COVID symptoms ทั่วกันตีเงี้ยซาบรัมฮาวินัทยา ventilator อันบุลเฟอร์ฟูร์อังขัดจู่อันนี้ละวะอันมานี่อันนั้นดัง COVID นี่เราค่ะอันนั้นซาชิม
ยังคนเป่าตูดีนะดินะดร.ดิกินนเกียนฮีจาวันเสียจีสไปเสียฮี hospital องเสียกันเลยกันมุขาสไปเตฮีอฟิตมาสไปลูเดฮีวะอฟิตมานั่นอีเห็นโลบเลยองเสียเลย hospital หลวงมังจูกิกมาคนจะดีงามีนินเขากายจะนัดเดียด body bag กับตัวมีนั่นดมุเลยเขา PPE สิลให้ไล่สุงกวนเตลมุเทโลไว้บางทีบางมูเลยมีปีเต็งมูเดย์กะฮีอะไรอุหายดานโมพุทธิกวัวขี้ยามไอ้กิเลนาวปังวัวขี้ยามสีฮิเจนโลฮีจาวันนี้จีฮีฟิตมาไล่ฮาร์ดมาไล่เสไปปังหอยบางองค์สีเทเลจูเห็นเลยทิลตั้มปีเกนดินมีปีเกียงอะไรไม่ใช่ตั้มปีดินกับกินตาก่อนเกนุนนฮิเลตุปามองคนดงเดงาดร.มองอกเตเฮียpatient positive เด็กค่ะด็อกเตอร์ที่นั่นมุ่งจังว่ามี question อะไรมั้งมุ่งจังว่ามาสมมุติ government ละมาปันจีฮงเฮ้ยเป็นข้านั่งข้า contact tracing ไปฮิจนะสมมุติตักมาหิวเฮียไอ้กิเลเป็น positive ขัด bang ni bang za zo chianga ki test non hoya chi khong ma mi pi te thei din non gen le chen sum mu le bang za mu hi wa bang za ki hom zel hi wa bang le hi wa chi tan balina thei lon hil le chen
positive mu tam je ka sum mu di le chu kalo chou hi lo in building in song vele chu sajau de ke ta jik chu atang pia community transmission le positive hung ki mu na tang pi hi kachi na gam ngon hin ten mo villagers le village authority le atang pe village authority chu fel na lai khen khat kho hau sa te bang chi phat le nangu doctor te hon sum mu zel hi lo mo positive rate asang le sum mu zel hi lo mo ti hin ten sum pen kha sum pen mu malaklaka gari hung ke dai udele humanitarian ground titen medical kanau pang thona laya gam sung ka ngai na jek chawa muntam pi contact tracing ale four wheeler le kanai dek pwa hile mun gam la pi le gari ke dai lo hun hale ke ma on two wheeler gari thau ka kithuna contact tracing che top kai ha mun khen khat bangai wa che phale ne khathong gen saw leng mo amau khan summu hilo manau sum zonga hungmo tivel na ho na tevel hintin je kha igam sunga community spread na tak takin le kamwa jepen he chu asuk bei thina dinga ka toi pen chu mobile whatsapp tu lai social media hat tama ma mo tunai bangale COVID care center apata YouTube video mo til adik lo pp tam pp hung ki gen ama bang clarification mi khat COVID case pen he adil hak sama ma point khat chau clarify di le it will take 1 hour khutin ten clarify thailo thil hinten hilele summu pen khaki mulai jang hilo intin ema on pocket apata isen ni le hung tamin hilele ikam sung safe na ding tia anaki ball he zon ten mi ptn le zakha he thim dingo katoi he
yai kha diglo hi ai ke le thuzwau hi chi hi medical la pana ki za a ki pawai wa chami ptn le kha i thailo kha igen gen lo hoi zo di hivyo mo gen ke le dam pe ni mi suk boy se sia tanaw te khat bangin summu hilo mon chia a hoi vele bangza muwa cha ka dolle lakhal le kim mu che a hile ki hom ki dia ken contest i positive sak dia nang singa tangin lan ki lakhat ka tangniam ka chile la u thial ke ya ichidan khong hi i theilo kha i gen lo hoi zo dinga doctor bia khoi kon dong dinga pu ka dot na hile sunday 10 october ni som mi si khatom mi si pen tapa in covid ana positive mi tam pian a chibai khak banga chidi alung hi mo hoi hia chendonga october 10 mi sian nei na mi a chibai kha hoi pen lung hi mo hoi hia chi ya don na hon pele chen hoi di
covid na thu kha izak na le asota chmai ni march khong apata le ki gen ki tang ko pi hia akilo son dan le gen le ngai non lowai thei ve ko hidin ka gingta ana ki chi bai kha i hi gen te na dia covid positive khat bang to ki bang ana ki chi bai kha hileng le ka khut vasil hepa mo a hi ke le sanitizer bang ka khut ana hi siang pa hoi changa mask khong hoi taka jang nai chika kichibai ji cha kha anai chik a hitang pia mo hoi jaka chu chance chu midang akichibai khalo te sanga chu tamzodin ka gingta hilele akichibai zo pilwang taka khut ana hi siang hiam khut ana sil khong hi ale chu lauthon hwai din ka ging takeya huchilo a hi ale chu kai thei na chance chu om din ka gingta mo udikina gen be ule
to madam nu again ma bangin to mi thi chungchang pen khai le contact tracing in charge ka hin zalin point khathung tapping khatin zakhan ko to bang mi thigala na chia ami thi ina ana kichi bai kha high risk kimu na hi ula anytime we are ready for you mo hungki report unla stigma na ya in keng te in sak te vel nagen ulawa agu ka na hi udale contact jing thei ha doctor Thanglalmuang nagen ngamlo udale asa te di hinten asa te zosin ka phone number ne hiwa jekha anytime you report to me keu chu nawading na ki sem hintin ki gimme mailo nanguna ki ready na ko le chu keule ki ready jing test thei jing the after 5 days in the last contact apatin 5 days atun kon phale na list te hung pele chuno ko hilele doctor in force doctor in virus a control di hitalawin virus pen team work hintin je khat nangula male balance hungai keula male balance hungai ipan iwai pan khomule chu transmission ki break thei di hin tin a chain kha je kha to sarpa na gen ma banga hung anaki chibai kha le a positive to na ki khoi khate kha bang tik lai pe wale a test di hin tin a zole je thua hung ki gen te zo si kha a free day ti le ko hung gen ki to te test man ki la lo de
ki pa hoye mi bi thei u da hi sumbang za seng di ki te zi le kwa ke pai di chi khong hi a thei u tampi pe na hi mo hoi jaka Dr. Thanglalmuang contact tracing ale in charge ai na ki pa hoi ma manon gen chiang the ya Madam Seilaja, after how many days of the last contact do we do testing again for the patient, or do we really need the new SOP sets no more? Not necessary. What is your opinion about this?
First, I want to correct one thing. The total number of positive in Churachandpur is 1,140, not 800. About the contact tracing, I still feel that we should go for contact tracing, and then we should quarantine all the positive people, and then like as far as possible we should quarantine them so that we will further stop the further spread. Usually we used to do after 5 days of the last exposure with the positive person, but right now according to the new SOP they are planning to stop the contact tracing and then planning to stop the testing as such for everybody and only for the symptomatics. It's just like what's happening in USA and the foreign countries where the health facility is very, very good. It's not comparable to what we see in India and mostly in Manipur and Churachandpur. We should not compare with, we should not be like imitating USA and then like the European countries and all, because our health facility is very bad actually. We cannot be like them. And then we don't even have proper ICU, which all the patients, most of the patients, they need ICU, COVID positive people. Like, what we, like, that's it. What?
Yeah, thank you. Again, ut penso America khong kha doctor khatin mi zakhat khongin kain chen. Manipur khong Churachandpur again cha doctor khatin mi sanga khong kian kain chen. Doctor bale thum sita Manipura. Why jaka mi thuma sile chu 3550 mi sing khale sanga to si khomu chini sable again kha pendin ka ging ta. Mesin te nei tokin bang to khile men power rom ke lekha akana nam lo hi chi genut penin ka ging ta ni nga zo chiang ena ai kele isolation om di hoi zotin som zo chates chi pen hi government in SOP heng a hi mo ni tu niang swak jing chele ki ko ka khomai the hi hilele poimo pen chu ele na ki piven di hi doctor om lo hi ke medical te ki positive so nurse bang mi sagi doctor bang mi guk mi sagi staff to am to ma leongom cha kha hospital bang khak ji je ngai department to am to ma boyang boy hoi kha asafar kha mi te mai ja ko kha medical asem te health department asem ten kha ki thuak in chen mi pi ten kha ngai kho khoi ma hilo hia chi tu zan ang zuwa kut ka hi tu pan le question dong hen lan azona lam simina on zo le hoi di
Dr. Mangi nam ge na SOP ki he kai achia wa jo chen contact tracing kha ki nak bol non lo ai achia achi le lamka din mun hi entale tua khani tenga pung deu mo achi le contact tracing bol lo hi le hey implications banga hi dia bol lo thi din mun ma hi diam ai gen taksa ma bangina banga gam khang to ti bang banga health facilities ni te hoilo mo wa janga doctor to patient ratio kha ithi sama bang huchi le lam ka te contact tracing bol non lo huchi pai thi ma adi hidiam ikile he kha alu thelo government ina SOP atel sakki le khotanga damna huchi ke khotanga idamna dia voluntary ai bakite sak di hizolo dia mo huchi hiki le kha chup ki lo azak tak le bang chitu kina law hoi dia ekile bang chitu ka boy hoi de hi dia. ye kha banga ye kha afford thema ye what will be the way forward mo lam ka tin na bangi hi di ho isa kwa pinan dong dia ma Dr. Diki
hak sa hi hak sa pet ma hi I atira khan mira mina antor dan chu mureng thau ma ila kan ramina kan tor dan tur chu kan lo predict via I kan lo in ring via ma se atakaron khen chuan alowin ang lova. In the beginning we quarantined everybody who came 14 days, supplied food, supplied like almost all the essential things. Kan sarkar re theya kan ram re theya lockdown ti po in nitin a chop zong ten an twar ma sabera kha akar laka mamo lam na hun kan hong lo theilawa kan han honga kan hon lai chuan safety distancing she chang to loin kanin no le loi loya I sarkar hausa anga lockdown ina tombek tur tia tu agency na moni an ina until va semte chuni se thushanania ani lo chuan lockdown po ti ila kan lockdown kar laka mamo cha khai lam na hun kan honganga khati una kanin phus to le noi don thowa I lockdown an tha dul an unlock da chan hi coronavirus ahla omlo tul ani lava anan na ahla omlo tul ani lava kan economy na tuar na sa chuan a enkol shim po kan thin lo tu na hen kapwan le ka soi le du chu rem chang la in soi ang khan atira chuan returnee zong kan khung khoma e tur le engkim kan supply ya tu na chuan zanina kan patient admit te nge po ina trangin choron in pero u kanti achan chu we lam ni lavin I saptuam puni se local puni se chanpuina support chu kan dong tha amai ro chu march atang khan chumlo chat lawin achunga nurse an oma 4th grade nen duty kan oma kan e renga patient te kan chum ke pa kan perenga adai seng lava tuna chuanin zanina kan patient kan admit te pathum po kha ina tangin in chungten e tur in pek ti ro o kan tia chuwang chuanin contact tracing hiti in muchwak ta teu poni ila khonge kan da don enge an e don engtinge kan enkol chun zom don chuwang chanin an positive kan hu chwa symptom an nei lawa ina kan tir ho hian hengtal hi jon that tewin protocol hi wazui sela I an responsibility midang kai chong lo turin va in khung se chuan mani kan soi ngai athu pui chu angai we have to be responsible not to get it not to distribute it ani ber achan chu contact tracing ti to lo la angai ngam om lo ti zelila kanrin ayatam hi a om don si a chuan symptom anron nei chu thushan positive ani ti an shata psychological problem ama engma in soisel na nei lo po positive ani ti kan shia chan hau thon na nen lungphu arang ngala isolation na dam lo som sari vel kan admit to kan ti zinga khan half of them were having panic disorders anana effect po anana po in anxiety athena joinin hemi astigma le ahlau thon na zong ne na nita a chuwang joinin contact tracing dia mu cha zung po adu online what will we do with them join unnecessary emotional problem kan thenangem chuwang jon symptoms an nei lem lo chuan I tu po hi helai om zong po hi natna kol mai thei anga in ngai la film kurila I midang kai chong lo turin film kur ta cheu ta ila symptoms alan chwa chuan in test mai la ti hi sarkar kal pui dan ania pompui lo thei lo chin po om it's risky but it's risky anyway the other way also
tua doctoron gi na patina atung lamina banga sap to amina khota ngitale ekile organization to amina banga government na ya police te ya pan pina pe so umu wai la ya chu lamka ke su chitu katam nai lo male le tu na he ke song tam ta achile pan pi na hi government na pat le facility tam piom non lo ichi ma banga fan le tom deu hita uchi lai meeting la thuak deu de kisa achile hei zon la ka kha sap tua mina ekile khota nga te voluntary organization te ekile student organization chi hei te adina role poimo ma hina kamua ekile huai hun lai a sumina thote phatwa malo wichi nai lo na tu hun a pan lak tak tak zoka a khotang a village level a vengdang te lut di phallo ichi dan te hi a task force atak tak activate huni zolo ye chi ngai to naoma e chian sukhak tak a kha banga law non lo da na om de ki samo che government ina SOPN kha SOPN bolin chin anlokon bol chenga uchi dana nakiom uchi hi le achi le tua protocol lom te to i society ai tradition ni culture rentale ki conflict ichi na hong sok tai chu gin ti de misi ombang chu gal lo the lo wa ki ngai mo achi le government SOPN la hoi dan te phallo achi le he government protocol to was chenga society ekile tradition ni culture ka ki conflict ile so what will be the way forward yes any suggestion or suggestion om here ekile advice om here ekile what strength do you find in our society or tradition which will help in fighting COVID-19
don't know na eto ki tuak di ko hat question khat mi pilam panong payuma kon gen dinga i COVID-19 ja ka corruption ki gen te thil di kai diam i diglo hi konchi dinga mi luang tunga mi luang mana sum ne gu hi le chu adik thei diam chin kon dong mai dinga mi luang mana hi COVID-19 corruption a fanong pai te i nek le chu mi luang tunga sum ki ne hi mana kha dik thei lo hi mim de hi hoile athona na sum ne ki athona pai lo dinga hi chin kon dong dinga hil chet na om thei diam honchia ai to ki sai ya hi afan kha whatsapp le mutham dingwa afan leong pai thama i district hospital ke le district wise ang pai saka akimu hun bale om i asai asumlam saya pangkhalo ai ke le administration lama tel khalo aki jakina aki thei chet ke hai hi adon hak sama ma himale sumchu heka hi covid jakina sum heka contact tracing tebang ai kele patient om tebang CCC covid care center om tebang ni khata mi khatunga zani seng hoi pen nek man hile atuam pen thu tuam adam doi man pen hoi jaka mi heiza district mi sang khatwal positive ta sang khatunga mi ni bangza mi kharin ni khata bangzam di ai kele mi kharin CCC abang zam di chi hi ana ngai to pilame chana khwale chu sum tampi beita hi china kon dong dinga hoi jaka ahil chadan lom thei ke male a corruption hi te hi mi luang tunga sum ne hi manuna diklo hi amau tunga le tu thei hi chi hi we wa din kon gen dinga I hoi Dr. Muang kon dong dinga contact scenario kin lo kha se ta hi le thei siam tho ki pa hoi ka sa I media khen khada kha a host khen khadin kha a base om loa I doctor ten mi referu hi hoi referu mi tanga pang chi hi gen se kwa akiza mun sima a thailo pi khoin gen hi ule chule I hai ma mai dingwa himale adata om ge gwa I adata te thei ge go to lo hi ka ut kya hei context scenario kha Dr. Muang gen hen lan hoi
contact tracing iti kha a doctor lekki bol zo talawin amasa chu doctor in positive nalama vakidel zelin contact tracing vakibol hintin to chu ni khat banga mi som wala hung positive le chu mi som ni khat ve ni bang kha mi 23 positive in zan khat thua jiteng contact tracing mi in som ni le thum chi de kha ki zo talawin a reverse lam zo kin hung le hung ta mo a positive family ten doctor hung le contact zo tawa a zo le village task force mo te active ma wa village task force kan khatin doctor le tung se lawin a inten sil ngalwa azole a contact li sa hung pewa jite kha a testing dini ki fix sakin a ki test kita tideuda na kha ikipan pi to le je khan I ana kha smooth zone ka ya mi pi tele positive ko to bang yum le doctor in hung approach khel ngak lawin mo and doctor approach mai theyim je khanga I to itina zole task force ten le na hung ki thu phi na kha hung no si de ki un la continue zingun la min submit content me na ana and kai ti ho kha I bonun mo pok nan ko hitino azole je point chunga ka hung clarify ki tu ta hile village khan khat lo khen khatin testing man kila ki ti pen hi test man kila lo hin close contact patient thil zo si afeka free hin kin ile ko ta bang covid free him hi ut ki test ut him bang ma reason dang him office join ding him bang him velom le cho jite kha cho sum kila sek ma hin ile je khale ko ta bang in apoi mo a BPL card ahung choile amawa ding khale free hi kitin azol student exam ding khen khat umin covid free ngai ahi dele amaule admit card ahung choile afria ki bol sakite ti le ka hungen ki tuta ngazol to charge ko chung chang hi le chu to lockdown le ki hong hitan azol mi pi le khabzo di gol hitalo azol eule Covid apatin kisel le hinu le kisel zolo di gola amta mo a covid na bi hi phatle ki khop le ki khop me ma ding ki khom pui ti le ka ti dik pa aki khom pan le hitawa ki khop le ma ni responsibility he tino bang ma covid prevention dinga dam doi dang dik lo hi zika SOP nei te distance nei ding example a bikin bang ki khop le alo na pen chu line khata mi pathum mi pali bang ki chu zel hin le chu distance ko ding le chu mi pani ni ki chu zel mi pani hung chut ngai tan ai le chu ki khop na pen kha a member isuk kim ding kha je kha hi me ha azole ken keu ko chum lama kan again dan chun naupang Sunday school tele kai nai da photu hen la Ajik to Sunday school hi phala naupang phunoi noin naupang in SOP bang pi distance ko man maintain lo hintin jika khan Sunday school ki hong kit vel chu khuti talun ka recommend po azole beating lam tele kum 60 years and above mo TB to diabetes nei te vel hi le chu ina phot ka to ya muntam pi contact tracing akibol na khan aki experience a mi pi hi akipun khom phale virus pen active ma active zodik tu ken ama ka virus ka spread hikeu ten I chok blengun the spread will be very slow in one way this is not scientific research but then in Churachandpur scenario what we are seeing is that when people are in a group the spread is stronger than someone whom you are close just two person close she may be positive but I may not get the virus soon but when we are in a group the virus is very actively spreading zahi akilang ma experience khata hiya je ka chon 60 years and above the bikin lam ahi thile chi da phothi ten ozole naw pangte cut off phothi tenu abikin naw sen nei ten mo bikin zot da phothi nu naw sen na hung positive le anu positive le naw sen na dinga le risin zahi hele hinuti ka to he
Dr. Panan gen na Now panglam te to pitching lam upalam te ho lo di adam lo de te ho lo di jon gena again u te le chu a fit te chu ki khop di chi na ong bang si me chu mo jam ni na again le ka la kin hilele alian te le port thau na pang ti na no mo chin alian te portin alian te le in ki thoi ja exposure chu ki bang ve non tho wai ja ka hoi pen chu hi lo pho thoi diam chi hi hon ngai to saka SOP bang hile biagina tut ding tut khom lo ding ai kele la sak lo ding fen pe lo ding chi te bang ilun na lama pol lo ding tu na le ni tu lo di chi te khong hi zui tak di hile I zo changa disinfect di chi te khong mi za khat tu na mi som ni chau tu tak di chi khong hi hongak sadia ke ki khom lo di ke gon mun kai ton di mo chi hi hongom thei ma ding ai ja kina ya hi question nebul ma hi mo mai ja kina he tu nu Dr. Biakhoih non gen le hoi di ki khop hoya sa ya hoi lo sa ya ke le public gathering himim mo on gen zeg le hoi di
Dr. Muang in le hon gen ta mo naw pang te to upalam te ki khop lo di hile mo ki khop di hile le chirani voi mo he hoidan again hile le ingai to ale a healthy te chimai ni mo alai hol a healthy dana ki ngai to te ma akum khong ale hoi te vaki khom in hoi kha SOP hoi takai va zui ke ale chu itki non changa isungkwan te tingtinga dia kha nan na hi pison tu ke swak thei ma super spreader Asia ka isungkwan te tingting naw pang te hina upalam te kha risk ka koi thei ma hoi bana ki khop se hi ke le mo gathering te sigal na hina molop na hitale mo mi tampi om khom na te kha I waitia I ho chang ale SOP hoi takai bazui ke le a ho pian chu bangma chilo hi mai thei hilele in sunga kha eloi joint family a ki teng tang pia hia naw pang te bang atek te bang to ki teng khoma hi na polut tu pian kha dam leng le midang te anathwak lel ma CP thei bang ki om thei hoi zaka I in kwa na ilai gui zom chmai ni mo I sungkwan tak tian hon thwak khale kha hak sapet ma dia hia atek te bang in hon thwak khale dena mem diki in le agena pupu khat bang cha COVID positive hi zaka ai lengai te to om kha het lowa ucha anabe mai chi khong iwangai to jang ina in kwa na atek te ipui pi te hitale amauti adia I hisa pale mo amauti tunga tung de hisa pale kha hak sama ma din ka ging ta a hoi zakina SOP khong hoi taka zui det thei I ma chu ki khop lo le a chidam hoi zu diam chi lampang chu ka ngai da na hi.
Let's hope it will not be forever. It cannot be forever. Covid hi a omrengani po in kan ladam rengani chuan there will be better days or there will be some new invention or there will be better methods. Kan culture aralta anga ngai lawila kan tradition aralta anga ngai lawila hun aron cha anga mithi te kan laral le anga lusun te kan tuar puyanga kan la in khom le anga tuna ri chuan I kan in kai chon humin damlo enkol na tour facility kan nei lava kan economy na zo lava kan infrastructure in a zo lava chuan kan guidelines in a zo lava guidelines kan nei te po tunaya mithina kal how feedback chu mas chu kan king via tu man anwa silawa aza thaka kan la tha it's all like that. Just imagine my own father tuibanga thil ti khomin an vakala jama aron honga ma sikeng chamo ma siwa chamo I hand sanitizer e mang chamo tuma khanan lo mang silawa aza tha nobody wears, nobody bothers mithi ina mas avwa antlem zo kan min pia kan mithi Zanlaya hospital ron thi te kha achung te kha kan thopui nge doctor ania feedback chu zuma zum hoya hi ko mi nga vel ta umas bul ko amu kan zolo kan thoi the nei na zolova kan tor thel nei na zolova mas noya thok la kan theilova chu wang chanin chol shi ila tile to ngai la wanguti na ni lo ahun lo ni kan zolo kan ko ka ni na zolo kalau na ta ni pon kan kaya ta ni pon hetan omanga hetan oma facility nei thasani ilang chuan okay kan chawang ma se han Joe Turin Han Machon Turian kan nei lo thu kan oi boxi lo
Madam Seilaja, since you are from Infal nang Infal dagi oi bani na what is the difference between you see in the public Churachandpur ga Infal any advice for the Churachandpur people wearing mask and all the social SOP anything you can say it out.
Yeah, Infal, even though the Infal West has maximum number of COVID positive people, but most of them, like 90% out of 100, 90 people will be wearing masks, and then they maintain social distancing also. And then whenever I see in ATM and all, they will be like standing 1 meter apart. Even in shops also, they will be standing like that. And most of them, they use hand sanitizer and all. Even then, there are so many positive in Infal West. But as soon as I come from home to Churachandpur, I see the differences starting from Kwakta. There is no social distancing. Everyone will be like grouped together. No one will be wearing masks, and then everyone will be outside the road. And then like they will be shopping and then going everywhere. And then starting from that Tuibong side, everyone will be like I don't know, like parties going on or something like that. So like 1% or 5% I can see wearing mask here. Even the hospital staffs also, like the doctors are wearing masks, but the non-doctors, they hardly wear masks. I don't know what is wrong with the people, but that's what I see.
Please advise to Churachandpur people.
So what I want to say to all the people of Churachandpur is the take-home message will be, please wear mask and hand sanitizer, use hand sanitizer, and then maintain social distancing. And then whenever I go to that new bazaar or any bazaar area, I see everyone, it's just like normal days which happened before COVID. But COVID is different. It's not just flu, it's not just fever and cough. It's more deadly than that. It's more contagious, it's more deadly. Even though like they say out of 100, 15 people they require ICU treatment. But out of that 15%, 3% may die like that. That is European findings. But in India and Manipur, this 15 people who requires ICU, since we don't have ICU in Manipur as whole and in Churachandpur as whole, this 15 people may die out of 100. So it can be your near and dear ones and can be yourself also. So please maintain this protocol. Please. And then there are already 3 doctors died in Manipur. They are the pioneers of that gynecologist, the owner of Subha Hospital, and then one more died today, and then one more died a few days back. So it's happening, COVID is real. So please hear our request. If one of us die, then the distribution of doctors and the hospital staff among the public is also very less. Like one doctor is distributed among 10,000 general population. If one of us dies, then 10,000 people will also be dead, because I won't be there to treat these 10,000 people. So it's not like USA, like one doctor is covering 100 people. So one doctor dies in USA, then 100 people will die like that. The stake is more in Manipur as a whole in India also. So please wear masks, maintain social distancing, and then hand wash. And then please do not go out unnecessarily, because we cannot stay at home. We have to go out, but you people, if you don't have anything very important, you can stay at home, so that we also will be able to treat general population, not just COVID.
Thi local na hun kena paisor chimta question hat 2 part mo uchi khat kaniya Dr. Lalbiakdiki address dina banga future prediction banga siam pudanan ki musim leita mo siam pidan ki musim teita, considering the present situation mo 3 months khatumina December haina bang din moninding dia mo 2 rate tai pai to le mo, like without any proper intervention or without any proper care, 2 rate tai pai to le 3 months in December na bang tanitung dia. What will be the situation in December? And to prevent that will be the first part. A second part actually why tunlo thina dingina mo uchi ke tunlo na dingina stakeholders tom te primary stakeholders ka health department hitale actually secondary stakeholders ka society hitale ekile church te bang hitale mo haiti role banga hidia medical department ka forefront ta ding hile actually no one support to dina he secondary stakeholders te na bang chibay na panon lew na chia mo. The first part is your prediction, while the second part will be the role of the stakeholders.
It's difficult to predict. Like we keep saying, COVID is a novel thing. It started in winter. Normally, virus hi winter khovata damrei zok turanga yanya. They are supposed to thrive better in cold temperature and like humid places. Ma se winter layaron intran khania tian summer chungin apik lawatuna boruak aron nuam chotana. It's a very pleasant time here. Ma se tihanin adar hum chu anya. Like based on scientific evidences for other viruses, winter chuanin viral illness chu tamjok turanga yanya shitang pangai flu cold flu tam hunanya so it's difficult how it will spread ma say based on how we are reacting how our people are taking precaution I don't know. It's difficult to say. We all claim that we have kan immunity at shaa eng ma kan tilawang kan tia. Pathian zara rin ay tak chuan kan ti phuk big lawa. Future to chu kan she lawa. Ma say one thing is sure. You will not have much healthcare providers left at this rate. Casualty ni tin duty kan in choka. Chohma chohnuzan. Nizana Khan, our colleague, was having duty last night. He started duty at around 5:30. By 9, he in the group, third positive case. So our doctors kept on being exposed. Along with him, the nurses who are on duty. So it's difficult to predict how it will spread among the masses. But there will not be much healthcare providers left for you all if it goes on like this.
The prediction and the role of the secondary stakeholders.
Okay. Ram Shang studies Shang Entinan Kantilsha Tepo what they find in USA, what they find in Italy, what they find in Anita. Kenita na comparable to I think it will be Mizoram. Mizoram then yan kanin compare thei beranga atsan chu kan society inanga kan lifestyle inanga pathian zara Mizoram achon mithi an la nei lava an contact tracing an positivity rate atniam eba putur omber chu an local task force an active ema mi puin thuan oi boka I mean, the local people, they take it up as if they are the owners. They are the owners. It is being tackled by the owners. Here, we have to kind of threaten you guys. We have to kind of show you all the ugly sides. We are hoping that if we make you fear it, you will be a bit obedient. Mizoram context and Chuan local in. And being a positive and in task force in Tikhan contact tracing and tia, in support group and oma, kami how emo in psychological support, tia and in support cha. So Keni Tanchuan can comparable bear to like an encall take to Mizoram and Ikaringa. The stronghold is the local task force, the community themselves. Sorkari in Tuchapui Chua, all the protocols are equal in all over the country. It's not different there, it's not different here. Chuan in mishing nature, chuan ang tlang puya thu oi lo le rebel le lo ti ruk zeu zeu du vek kan ni amai ro chu anei tu te rama chuan an mani in responsibility and lak chuan in ti hian tun thlengin transmission and cut down theya mithi an la nei lava kan enton tur nai ber chu an ni ka ring.
Question bangza hiam he viewers ti apati nang lutoma he te kon dong zat dinga. Death rate in Western country is very high. Why do we have less and more recovery rate? Is the virus different or was it just luck? Dr. Seilaja?
The virus strain, there are around 7 virus strains. Initially, it used to be very mild. The virus strain was very mild, and then they just had some fever, headache, and rhinitis and all. But somehow the virus, which is very dangerous, which is very deadly, it has reached Manipur, and then till today there are 97 deaths. For the whole state, for the whole Manipur, and 7 in Churachandpur. So the recovery rate, it's not just about the luck or something. It depends on the person's immunity. The death rate is increased when you are older because the immunity gets lower. And like the death rate, the death has not occurred in children less than 10 years. And then Like a 20 years girl was dead because she had some comorbid condition also. The youngest was her, I think. And then most of the deaths are occurring above 40 to 50 like that. But it doesn't mean that 30 also won't die. Like 37 also without any comorbid condition. Like some around 10 maybe they have died. Like the maximum are among above 40 or 50 like that. So it's not luck, it's our own immunity. And the death rate is more among the males than females because males are more like alcoholic, smoker, their lungs are bad, their whole body is bad. So the females are better in that case, that's why also.
To he patazil thi di khachun na dam thi na hi kem hoin mo na navi khak jen le hu cha serious lo de wale om khathi nahi mo ba na question khatom lai since many mi tam pi te dam do yom ki male dam zelu chi hi ya hu chi le coronavirus chi hi law hoi lua na law hi thi dia chi to ke sai ve Dr. Biakhoi.
Dr. Seilaja in le on genta immunity in that na do na kha meeting tinga ki banglo ma ko he tu teng le kan na do na kha ki banglo hospital la CM vek vakwan vek hileng le khen khatin an la kha mai thei khen khat kha an la kha khol mai thei in that na do na kha a ha ta le itak sai na hoi virus pen kha anado zuale hoi ki dam chi dan hi ziakin hai a serious low cha ingai thalaya inat na do na kha kiya ha di cha ieta to he ya kalom tele enleng anat na do na he ha di cha gen thelo ka himan ne na inek le idon bang a hi ke le I mut khong a hi ke le stress khong bangin le inat na do na kha su hard low a hiya huji banga mi dam thei tak banga kilang hele le stressful de wan om bang le om thei a hi manina inat na do na ki bang lo a hi zia ka kha lo mo ka ki chu kadam khenge nge di cha ki gen thei om din ka gi ging takia hoi zakina ki ven siam ma poimo a hi vitamin C khong tuilum khong dona hu cha dam mai zel wa hi center a tele achiwa center a kha he kon gen zek mai dia center a ki koite kha agim lote hilo yinchin midang te asungkwan te hiam a hi kele a khota nga anadal sak diven na a ki kem hoi chimai ni mo ki kem hia amau kha damlo na bangyam symptoms ani chang wa chu hospital ong ngai ma care hong ngai huchi dan hi lo hi manwa kha hucha ki koi tuam ahun a virus ina mia lo son thei di hun tana ki koi tuama hucha vitamin C khong an na do tu su had di hi ki le tui lum don hi tang khong veng tu di hoi ti hi chang a hong dam khezil lo hi a hoi zakina mok mai ngal luat hei virus kha ngai inep luat di hi lo hi inat na do na hat ke le toy lai hoi lai nat na dang tam lo ni lo khong in le si mo the hi chi kon gen di
atop na dingina kan chi dinga toy gen sa ti hi prevention wa chena management uji ke le treatment hi atang pi na hi mi positive form chengina aboy hoi ma denai gin ma baina astik ma mai hak samo uchi le khotang te ekile saptuam te na mi na positive ta te bang chi baina pan pi thi dia bang haksat na atwa ko huchi bang ana positive kha te na mo bang haksat na atak sadam thi na chu atwa di thi sa lungsim ngai to na to adi thi sa bang chi bang ho na experience wa bang chi banga khota uchi kile sap to me ki me malten pan pi thi di ai chi Dr. Diki na the last question din an don sakle ama
thil to changa I reaction chu ki bang lo vek di chu here like for all the rest of us mi thi kan ne yin kan traditional style la in ra la in thut pui nge kan langai na ang deu khan kan ril rupo kan thak vi anga yanga for the sick person himself we cannot go on sitting with them abai thak na ber po ania dam lawin anbula nurse te luta anbula omreng tura an be sei la yin COVID is different. We cannot stay with them, and bereaved family lusun te pokan ompui thelo kha anya. So atua rate po in kan rilu putmang kan tha ka ngaya. Chuan kanin trong trai puya arala kanin ngai sakba ka. Entianan what I have been personally doing is chanti and positive chuan. We know the safe distance. Ahnai lu tuk nilava arala tangin angi ta tangin kan vakala halo hai engi an mamu inayem til chete te like just token engi moni itu claim te va pek te ang te kha, not like going in shaking hands and sitting with them. Arala tangina in hu thaya, that is what I am trying to do, like I have been doing. Vakala va thut pui kher thelo po in til kan in thon kan in rala tanga kanin mu thei te kania chuanin phone oma tun lai chana in phone theya enge koshan ang ponita se entianan youth group or this kind of health group polonita se enge moni helpline ang deu oma phone te po ina in biak thei renga mai chan care lo wa po abak chu bel turin e chuan san suggest tur te jam like we really don't know how to go about. Chuwang tak chana niya kan mang an em kan beadona kapatawa hiu kan ti na chanchu tingay na kan shelaw. Acha berturpo kan shelaw. Chuwang chuan kan mang anga zan tinan the positive tharzat kan chera phone kan ena kan hui pop ringota. Kan mga ang takzet ani. Suggest dur chadang po kasi chuwang law.
Regarding the stigma, contact tracing ki bol na village khat positive mun le volunteer te kha law talun positive te na kha positive te nei ti va belo mo ai le positive te close contact kha ka hung trace ki to le mi khat hung positive ki positive pa close contact ka hung trace le volunteer te hung pangta abel te la ka mi pathum hung positive mi som velin va belo mo positive te nei ti ko man nai lo de ti zenia kha a positive te kapoi jo. They say that they are not crying because of the virus, they are crying because of the discrimination they face in the society mo I nama mai jo en le yela na ke sakti ma mai jo the condition khan et sa ka hile positive abavel tema khava positive ki ta hilo chu positive pen chu gamla lawei mo eya leum the jing nang chunga leum the ke chunga leum the je ka chu kuma discriminate lo de hintin aile to an example in suggestion hat chu a community spread hat tolatan to an example in COVID positive hat bang thi talamo kuma chu vachi ngam hello ding oi chu achi te chu en le ki force thei dik lo mo idile a virus ka example mainly 10 days lo le ki test ki thin maybe after 10 days they can do some social gathering mo after 10 days with strict SOP izui lo ding oi le SOP ting katin azik chu zeki kala kha hi le chu a virus a in nei te khana positive khazen zen le 10 days nga kha chu a virus kha an be kit manding in kinem hitin ti khan ki bol da
azona ken kon bol dinga hun so chimdek ta holy manwama sapten health achiu kha dam theina hi pawin gen di hile ilung simle itak sadam na hi again pen hoi je kena hei covid to ki sai hi mi pite thei dai gen utso covid na veinia pan na sungte to thilo dinga hiu na luang tunga hoi je kin hei covid to ki sai hi maingal hel lo dinga hi idam theina le ki banglo hi a veilo dingina nang khuda ki nga hi again the nai lo a the nai lo te ai the nai lo te hi na gai dinga au palam te hi na veng dinga nang na ki ven thei bana na sungkwan te veng le chen dam din hi hei covid hi so dai lo dinga hi pathianin lema chi cha hong be mai dinga hi mo wai jekin hei veilo dina viewers te hina ngai hi tu teng hi dei sakna lian pen EBC health board lama panina kon gen hi ki pa ki hei zaina holim na izo dingo